Hello, Elevation Health family. This is Dr. David Yachter. I have an important topic to discuss this morning, which is under the heading of anxiety and depression, which is very, very common. It's actually one of the most common disorders that people are facing today. 1 out of 5 people are developing anxiety disorders and are 6 times more likely to be hospitalized for psychiatric disorders. So it's one of the most common things that we're seeing these days. And it's not uncommon for someone with an anxiety disorder to also suffer from a depression disorder, or vice versa. About 50% of those diagnosed with depression are also diagnosed with an anxiety disorder. There's also something known as major depressive disorder, which is the leading cause of disability in the United States right now for ages 15 to 44.3 years of age. So when we look at that, we realize that there's a lot of sickness, a lot of suffering, disability, despair, depression, and it all has a common thread when we start learning about this. There are different forms of anxiety: panic disorder, social anxiety disorder, specific phobias, obsessive compulsive disorder, PTSD, post-traumatic stress disorder, and just stress in general. Everybody experiences stress and anxiety at one time or another. The difference is that stress is a response to a threat in a situation, and anxiety is a reaction to the stress. So it's just sometimes how we react without having any control over it, or we just let our physiology pretty much guide us in terms of the downward spiral in our health from there. Anxiety disorders affect children as well. 25% of children between 13 and 18 years old have anxiety disorders. And research shows that untreated children with anxiety are at higher risk to perform poorly in school, miss out on important social experiences, and engage in substance abuse. So when it comes to treatment options for these types of issues, there's therapy. We know that there are therapy sessions that sometimes people can try to cope with their situations. And very often that proceeds to treatment with medications and prescriptions. And that, very often comes with side effects, as some of you may be familiar with. General side effects that are associated with anti-anxiety medications include drowsiness, confusion, clumsiness, fatigue, tiredness, lethargy, headaches, and potentially even depression. Again, here we talk about the treatment for a disease actually causing similar symptoms as a disease itself that it's being treated for. Other side effects, when used for a long period of time, include flu-like symptoms, the desire to commit suicide, homicide, nausea, problems with sleeping, problems with memory, and a change in personality or emotional clouding. We see this, and this is a well-known fact. I know historically, one of the things that is very, very common that we see in things with many of the school shootings historically, Sandy Hook, Columbine, Virginia Tech, a lot of these massacres, in the profile of the shooters, they have these psychotropic medications, many of them antidepressants, anti-anxiety medications, and it's just the perfect storm very often that pushes an individual over the edge in many of these horrific situations. So we have to be very, very careful with that. And not that there's not a time and a place where it sometimes may be necessary to help a person that's drowning in this condition, but long term, some of the side effects may even be worse than the condition itself with these medications. And trying to reduce and get off these medications is it's a tough climb. It's not something that's easily done, although it is doable. But it is worth mentioning the side effects of these medications and sometimes what it leads to, and then really what the alternatives are, and the unconventional approaches in terms of treatment options. And one of them worth mentioning is, of course, chiropractic care. And one of the areas that we see disallowing the body to handle stress is a subluxation at the top bone of the neck. We call this the atlas vertebrae. The top bone of the neck is what actually wraps around and protects the brain stem. And that area is very, very important in terms of enabling your body to manage stress, enabling your nervous system to handle stress, adapt to its environment. there's a part of your nervous system which actually facilitates something called rest and recovery, or a healing response. And that's why after an adjustment, particularly in this area, one of the most common things that we see and hear in our office is that people sleep better, they feel better in terms of their overall feeling of well-being, they have less anxiety, they can handle stress better, they have less depression, they breathe better. And so these are typically things that are very, very common that we see all the time with people who, especially their first few adjustments, initially starting chiropractic care, what a difference they see. I just wanted to read you one of the most recent testimonials that we received is from a patient who's currently under our care, Javier. He wrote this. He said, when I first saw Dr. Yachter, I suffered with anxiety, sharp scapular pain for about 8 years, soreness in both knees for almost 2 years, and was asthmatic for 4 years. I hadn't seen any doctors or had any surgery or medication for these conditions, except for the asthma. I have an inhaler. It says, now being after a care for only 1 month, I've seen great changes in the right direction. I'm not as anxious or nervous. My mental outlook and cognitive abilities are higher. My energy is up. I feel stronger with no lingering pain. Also, my neck was fully straight and now has regained a curve. So this is just one example of what happens when people are reached with chiropractic care. Their lives actually turn around. I mean, who knows what happens with a condition like that, where somebody gets more and more nervous, more and more anxious. They're not able to sleep. They get less and less sleep. You know, they don't become happier. They become more depressed, more anxious. And all of a sudden it's a slippery slope in terms of how it affects you at work, your relationships, the people around you, the dysfunction in your relationships, the dysfunction in your home, the dysfunction at work, and life becomes to get very, very difficult. But I've seen more times than you can imagine what happens in a person's life, how one adjustment literally could potentially save a marriage, a person that starts becoming happier, acting nicer to their spouse, less abusive to their spouse, less abusive to their children. They've just become a happier person. And it doesn't just affect that individual, it affects all the people around them. And I've seen that in my own situation. I've seen that in my own family. I've seen that with individuals that I care about and love very, very much. Who do you know? Who have you seen this happen to? If you're under chiropractic care, if you've been under my care for any length of time, any period of time, I am confident that you've seen the difference in the way you sleep, in the way you feel, in the way you're able to exercise, and your quality of life overall. And that's the burden that I carry. And I think about, you know, who out there in our community is literally just one adjustment away from having a better marriage, one adjustment away from doing better in school, going to an Ivy League school, or becoming, you know, the next doctor or the next president or the next Olympic athlete. You just, you know, when you remove interference to the nervous system, that one system that controls and coordinates all function to human performance, you're elevating that individual to be the best that they can be. And I don't know one single person in our community or on the planet, for that matter, who doesn't want to be 100% of what God created them to be. So I'm asking you to think about this, think about it carefully, because you and I both know that there's more people out there than we can count who would benefit from chiropractic care, especially in the area of anxiety and depression and the overall feeling of well-being. It's one of the easiest things that chiropractic addresses within an individual. There's so many people out there that need what we have. So I thank you so much for listening. I thank you so much for joining me, for understanding, for knowing, for developing your understanding in terms of how the body works, where healing comes from. Because the one thing that you learned in this office, first and foremost, is that healing never comes from the outside in. It always comes from the inside out. That's always the best approach. It should be the first approach. But people don't know that. They're waiting to hear the truth. And you have the truth. And I'm asking you to share that. I love and appreciate you. God bless.